The Hampton Roads Metropolitan Medical Strike Team, or MMST, is a component of the Hampton Roads Emergency Response System and is staffed from the 213-member call group, including fire and rescue personnel, paramedics, and EMTs, physicians, and physician extenders, and law enforcement personnel.
Well, the founding of the team was a collaborative effort between many of the localities, hospitals, physicians, and other health department and other entities across the entire Hampton Roads region to better prepare us to be able to respond to incidents involving multiple or especially mass casualty patients that exceed the capabilities of any one or two localities.
The MMRS for Hampton Roads is something that, for me as a fire chief, gives me a level of comfort, because I think that we all recognize that any one of our jurisdictions could be overwhelmed with the need for patient care, the need for potential patient care that may be absent a quick transport as what normally would happen. And so the ability to have the MMRS team respond and knowing the team makeup and the fact that the people have certain levels of certification. We know this in advance whenever we ask for the team, so we know what we're getting.
In our city of Virginia Beach, our opportunity to use MMRS could be a reality. We have, throughout the year, certainly we have a large populace, and then also we have many special events, over 600 a year. Some draw from 50 citizens to over thousands. So at any given time, there could be a need when we talk about mass casualty incidents. I think that's when MMRS would fit into our response matrix.
York County being the place where America's freedom was won, we constantly have different historical groups and other entities that want to come here to celebrate the significance of our part in history. We have various dignitaries come in, from the President of the United States to dignitaries from other countries come to Yorktown, and any one of those types of events is certainly an area of potential terrorism or just a mass gathering event with multiple thousands of people in a small area. And to be able to pre-deploy the MMST to handle a potential need for emergency medical services or any other kind of healthcare needs in the confined area of Yorktown or other places in our jurisdiction could be a valuable asset, and one that we couldn't handle ourselves without the assistance of MMST.
The strike team is trained and equipped to provide operational assistance and expertise to incident commanders regarding the medical effects of a mass casualty incident or any other incident caused by chemical, biological, radiological, nuclear, explosive, or weather-related emergencies that would place demands on the region's medical or public health resource systems. The MMST can operate self-sufficient for up to 96 hours with little or no logistical support from the requesting jurisdiction. This time frame allows state and federal assets time to mobilize and integrate into independent operations if needed. As needs or threat levels change, the composition, organization, and mission of the medical strike team may change to meet the threat or need through NIMS-typed operational levels.
From my perspective, the item that makes this program special is that you have people that are well-trained professionals that are practicing EMS service delivery in their own home jurisdictions. And when this team is called upon to go to a disaster site, those individuals that are well trained and practicing every day bring that skill set to bear wherever the disaster is.
As a battalion chief with Norfolk Fire Rescue, and also being a strike team leader with the MMST, it's actually kind of comforting knowing that if I have a mass casualty incident or an incident that's going to require mass decon, that I have that resource available to me. One of the things, as being a strike team leader, I know how that team integrates. So when I'm functioning in the role of an incident commander, I can pull on a resource that I already know and know the capabilities of the resource, know the number of people I'm going to be bringing to bear on the incident, and it's a good benefit to have both sides of that to be able to work from.
Based on regional threat assessments and capability gaps, the Hampton Roads Metropolitan Medical Strike Team focused its mission on the following 7 capabilities. mass casualty management and patient movement coordination, which provides for the coordinated transportation and movement of patients during an incident. This involves documenting and tracking patient movement coordination from the initial contact to their arrival in the emergency room. Warm zone triage, decontamination, monitoring and detection during any chemical, biological, or radiological exposure, decontamination of victims and emergency response personnel prevents further exposure outside the incident area. Rehabilitation and medical force protection of responders during operations of any large complex incidents. This ensures the responders do not become victims themselves by providing rehabilitation services such as oral hydration, rest and recovery, and meeting nutritional needs. Additionally, medical monitoring is performed to ensure responder health and safety. Medical consultation and coordination provides subject matter experts as consultants in the operation of a medical branch. For instance, team physicians are available to provide direction for appropriate emergency medical care to victims and responders. Chemical weapon and toxic industrial chemical antidote administration. The medical strike team maintains a pharmaceutical cache of nerve antidotes, antibiotics, and other medications that are immediately available to all EMS agencies, hospitals, and public health departments in the Hampton Roads area. Many of these medications are not available in standard pharmaceutical drug boxes. The team is capable of providing functional medical needs sheltering assistance in emergency shelters. The team is equipped to provide mass fatality assistance when an incident causes loss of life and can assist with protecting the integrity of the remains.